Good afternoon. I'm Michelle Williams, Dean of the Faculty here at the Harvard T.H. Chan School of Public Health. It is my great pleasure to welcome all of you today to our event, Human Rights Equals Public Health, a conversation with Michelle Bachelet. This is a program in partnership with the David Rockefeller Center for Latin Studies at Harvard University. This has certainly been an incredibly turbulent time for us all. The US president is now one of the more than 7.4 million people in the United States who have tested positive for COVID-19. Globally, the official death toll has exceeded 1 million people. The numbers are indeed grim, but what's even more disheartening is that this pandemic's impact has touched every facet of public health and beyond. UN Secretary General Antonio Guterres warned us in April that the pandemic was not just a public health emergency, but also an economic crisis and a social crisis. And it was fast becoming a human rights crisis. That warning has since been borne out tenfold. A recent Freedom House report said the condition of democracy and human rights has grown worse in 80 countries, which ultimately means that this pandemic has reversed decades of progress on poverty, healthcare, and education worldwide. Add to that equation the institutions that are meant to hold those in power accountable have now been weakened further, constraining public health systems. And the very people bearing the brunt of all of this are those who were already the world's most vulnerable: Black and brown people, refugees, indigenous groups, women, and the world's poor. Just look at these incredibly moving images of those hardest hit by this pandemic. COVID-19 will push Latin America into its worst recession in a century. COVID-19 has further deteriorated conditions for refugees in Europe. COVID-19 has exposed the fractured and unequal health systems across Africa. COVID-19 has been used as an excuse by Middle Eastern governments to tighten their crackdowns on dissent and the press. And COVID-19 here in North America has led to the most unequal recession in US modern history. It is worth repeating, this is an economic crisis, a social crisis, a human rights crisis. This pandemic is a global public health crisis of epic proportions. And addressing something of this magnitude will take a monumental effort by all, including governments, individuals, and experts. It will require thinking and acting differently, even possibly changing the way we all engage. Our guest this afternoon, the UN High Commissioner on Human Rights, and the former President of Chile, Michelle Bachelet, deeply understands the magnitude of what lies ahead and what is required to make things right and start the very difficult road to recovery. Her words in March were as follows: COVID-19 is a test for our societies, and we all are learning and adapting as we respond to the virus. Human dignity and rights need to be front and center in that effort, not an afterthought. And it is that effort for human dignity that makes this the most important public health crisis and public health recovery of our times. Protecting human rights is a matter of public health. And so I'd like to thank Michael Sinclair, Executive Director of the Harvard Ministerial Leadership Program, and Bob Lendon, the Richard L. Menschel Professor of Health and Emeritus Professor of Health Policy and Political Analysis, for helping us make this conversation this afternoon possible. And with that, I'd like to welcome the UN High Commissioner of Human Rights, Michelle Bachelet, for being here. And to thank you, Guillermo Arduino, CNN anchor and correspondent, for helping us have this incredibly important conversation today. And I turn it over to you, Guillermo.
Thank you. Thank you very much, Dean Williams, and good afternoon, everybody. Good afternoon to all participating in this discussion and everybody virtually connecting with us. Very important remarks that probably the most important word that we have in our disposal to make a difference is to be aware and also to adapt to these new times. If we want to ignore what's going on, the result is going to be disastrous, and everybody has to be part of this situation to work it out and improve it for everyone. The discussion today is around human rights equals public health. That's the basic concept. It's simple, but it has a profound meaning. And there are many things that come along and we need to bring into the conversation to understand, especially in the context of this global pandemic. And I emphasize on the word global. There are inequalities within and between countries, and everything is tested at this moment. We need to understand what's compassionate, what's right, what's fair. We need to work towards those goals. We're talking about also long-standing gender inequalities, things that we think about and we hear about, but we have a hard time bringing it to our soul and working on it to overcome these issues. Also, wealth gaps, pervasive racism, deep-rooted health disparities, to just name a few. We're talking about the groups that are particularly impacted by this coronavirus pandemic and these differences. Of course, the pandemic made everything worse. Let's think about women, children, migrants, people of color, and the impoverished. I am honored this afternoon to be joined by Michelle Bachelet, the United Nations High Commissioner for Human Rights, whose extraordinary personal story and public leadership inspire us all. High Commissioner Bachelet will take questions from our distinguished guests and Harvard Chan faculty, as well as those who have submitted questions in advance. We welcome viewers also on CNN en Español and viewers on Facebook, YouTube, and anywhere else where you may be connecting with us. The new world, the new virtual world is multi-platform. So we want to bring that concept into this conversation as well. High Commissioner Bachelet, thank you very much for joining us. Good afternoon.
Good afternoon, Guillermo. Good afternoon, Dean Williams, and of course, all dear participants.
Why is public health a human right? A basic concept, but we all need to hear it from you.
Well, first of all, I'm very happy to be here today with you because I think we all feel the same. We're so committed to this. Health is a fundamental human right. It is indispensable for the exercise of many other rights and necessary for living a life in dignity. COVID-19 has made realizing it even more pressing and urgent. It is now evident how much in a pandemic context one's health can depend on the behavior of the others, and how avoiding the collapse of any country's medical system is a matter of interest to all of us. Promoting public health is crucial, with the scientific community and academia playing an important role. Public policies to protect everyone's health are essential, and so are the protection of frontline health workers, their working conditions, and their adequate remuneration. In addition to a health crisis, COVID-19 has brought to the fore pervasive inequalities and structural discrimination that are leaving wounds in every society across all realms of life. And this is clearly manifested in the way people enjoy their right to health. Even before this crisis, socioeconomic determinants of health, such as inequality, discrimination, and poverty, were already major reasons why millions of people lack access to good quality health care and services. Now, those already in vulnerable situations are the ones suffering the most from the health and social economic impact of COVID-19. People living in poverty, people of African descent, and members of racial, ethnic, and religious minorities, whose rights have been for too long affected by structural racism. Indigenous people, people with disabilities, older people, especially those in care homes, migrants and refugees, women and girls, not due to any inherent vulnerability, but exactly because of long-standing discrimination and inequality. So let me be clear here. Gender equality is not an optional extra, nor it can be cast aside in times of crisis. It is essential to peaceful, just, and resilient societies. We will never meet the challenges we're facing or any other if we play with just half the team. These are really challenging and complex times. As a medical doctor, I know the vital importance of science-based measures to protect public health. As a former head of state, I know governments have had to take very difficult decisions. My office has issued human rights guidance on several aspects and impacts of COVID-19, including on emergency measures. And as United Nations High Commissioner for Human Rights, I know that the only way out of this crisis is with more civil, political, economic, social, and cultural rights, not less. The pandemic should spur us to adopt strong transformative measures to heighten the powerful protections that human rights-based policies can provide by promoting public health, public confidence in official guidance, and greater social and economic resilience. We cannot go back to the normality that made our society so vulnerable, fragile, and unequal. From the devastating human tragedy brought by the pandemic, we have a once-in-a-lifetime opportunity. We must build back better. For that, we must address the inequality pandemic exposed and magnified by COVID-19. In today's context, universal social protection is a crucial, life-sustaining tool to enable access to healthcare and education, protect the right to housing and food, and shield people from extreme poverty. But social protection for all is a distant dream for most of the world's population. According to the International Labour Organization, ILO, 71% of the people alive today have no social security coverage or only partial and inadequate coverage, including almost 2/3 of the world's children. Women who often take jobs in the informal economy are frequently deprived of social protection. Sustainable recovery efforts will be efforts that advance universal social protection, including universal health coverage. They will integrate access to education, protect the right to housing and food, and shield people from extreme poverty. And they will be grounded in inclusive, participatory processes and ensure equal opportunities for all. Everyone must benefit from rights-based response and recovery efforts. And I cannot stress enough, any vaccine against COVID-19 must be distributed as a global public good. For that, strong collaboration and solidarity will be essential. I am optimistic. Together we can rebuild societies that uphold human rights and freedoms, including the right to health. Aside from being legal imperatives, human rights are the tools to build more stable, more peaceful, and resilient societies. Healthier societies in every way. Talking about public health is talking about how to build them. And I look forward to the discussion today with you. Thank you very much.
Thank you, High Commissioner. And I was thinking that these people that have been isolated from public view, because in essence, that's what happened, and that every sector of society should make an effort to make their voices more clear and louder. We in journalism, institutions, and the academia, that's another aspect that we need to emphasize on, who can give a voice to these sectors that have been severely affected by the global pandemic. So I want you to meet Marcia Castro, who is the chair of the Department of Global Health and Population at the Harvard Chan School. And she's also a member of the Brazil Studies Program steering group of the David Rockefeller Center for Latin American Studies. Marcia, it's a great honor to have you with us. Go ahead with your comment.
Thank you, Guillermo. Hi, Commissioner Bachelet. Good afternoon. I want to extend a warm welcome from the David Rockefeller Center for Latin America Studies at Harvard University. Before asking my question, I would like to take a moment to thank you for your tireless efforts around gender equality and human rights. You are an inspiration for us all, but particularly for women. So in the equation human rights equals public health, there is an embedded disruption factor in equality. Latin America, as you know quite well, is a region marked by striking disparities, was severely hit by COVID-19. The pandemic exposed and will likely exacerbate those inequalities. I would like to ask you to reflect on the extent to which the consequences of the pandemic could lead to a mobilization around a human rights agenda. And if so, who are the actors that are likely to spearhead such a movement, considering that many country leaders in Latin America currently represent a threat to democracy and to equity goals? Thank you.
Well, that is my dream, if I can say, Marcia, because when I arrived here, I realized that there was a lot of backdraw on human rights. I mean, it was so difficult to discuss with some countries, some member states, about human rights, to include the language of human rights in international declarations, for example. And so I thought, okay, if the Universal Declaration of Human Rights was possible to agree it after the Second World War, what if the pandemic brings to the people and all the consequences, not only the health crisis, but of course the devastating social and economic consequences, should help people understand, first of all, that we are all in this together. Second, that it's so important multilateralism. Third, that this is a global challenge, so we need all of us who have to do efforts and not just each other try to solve the problem by themselves. And third, that understand the importance of human rights. To be honest, I haven't seen it. I haven't seen that. Neither the global cooperation, neither the solidarity between member states, etc., etc. And we have two possibilities here. Either we understand that we need to do the changes that are needed, the transformation that are needed in the world, because as you said, there will be a lot of social unrest. I mean, last year, there were 80 countries where people were protesting on the street. Young people, not necessarily people from political parties. There's a lot of lack of trust in institutions. And of course, a lot of, I would say, lack of trust in the economic model that is not delivering the goods for the people, but also the political and social model as well. So you saw so many people. But now, when, and the Dean was mentioning, ECLAC has defined, for example, that the region of Latin America will lose 9.5% of the GDP this year, that unemployment will continue increasing, that poverty will increase dramatically, that probably we will have more maternal mortality because of lack of access to services, that we might have increase of child marriage because people will try to solve the problem in the family. I think there will be a lot of social unrest, and we have seen it in some countries, that people, when they don't have the restrictions measures, start demonstrating against what they don't like. And I think on one hand, it's a great opportunity to not only demonstrate, because freedom of assembly is something that is one of our human rights, but also to try to think together, and I think universities can help a lot on that, and others as well. What is the future that we want to build? What is the aftermath of COVID-19? And how in all of that we include human rights as a based approach, as a central pillar. Because I'm sure if we are able to ensure for everyone employment, food, good house and water, and so on, can you believe 35 million people in Latin America don't have access to clean water? So if we could ensure, that's the Agenda 2030 of the UN, committed by many member states, I'm sure that the people will feel that their rights are respected and that they want to continue contributing to their countries.
Marcia Castro, thank you very much.
Thank you.
High Commissioner, I want to talk about your story a little bit because the political climate in the United States and globally, why not, has changed significantly. So based on your own experience, your family, your father and yourself, living under an authoritarian regime, like many other countries in Latin America, are you fearful that authoritarianism is becoming popular these days?
Well, what I think is that unfortunately what we have been seeing is that extremism and intolerance are social phenomena that are on the rise, and they usually go hand by hand to authoritarianism. And we see rise, as Marcia was mentioning, in social tensions, but also we see that, for example, some countries have developed hate speech, xenophobia, anti-migrant speech, and unfortunately some leaders lead that kind of not sound speech, if I may say, and that permits that more people fear some people who are diverse, and then there is sort of this coming back to a more populistic, nationalistic, but also using the measures against COVID-19 to restrict freedoms, to harass journalists, to harass human rights defenders. So there is a risk, but I define myself as a strategic optimist. So I hope that the capacity of the people to be able to organize themselves, to participate, to hear, to make their voices being heard, it will be important enough to stop this sort of wave of nationalism, populism, and authoritarianism.
How concerned are you, High Commissioner, of the challenges that we face these days in terms of communication, fake news, and all the efforts, maybe by some, only by some, but to influence the world communication, the world conversation?
Well, yes, we are really concerned because on one hand, we need information, we need communication. I mean, always, of course, but in particular, in the context of a pandemic, you need people to know. You need leaders to tell the truth, to be transparent. You need people to understand why the authority are telling them to do A, B, or C, so they really can follow those instructions, and they can really permit that the avoidance of the spread of the virus, or if the people are being infected, that they can stay at home and so on. And I think that in some countries, look, what we have seen is that they have been restricting freedom of expression, restricting freedom of press, using as an excuse the virus. And there's no relationship with that. You can restrain certain rights when you have big disasters or health issues, but there are some that cannot be restricted. So communication is key.
Communication should be key for the message of gender equality, something that you have fought for all your life. Are you surprised that in 2020, with all the advent of mass media communication, the electronic media, etc., we are so far behind?
Completely true. This year, it would have been Beijing plus 25. And when you saw, and when I was mentioning the backdrop of human rights, I also have seen it on women's rights and gender equality. I cannot imagine, because I have to say, I'm going to say a commercial here, Mayor Guillermo, if you permit me. Of the 12 countries that are supposed to be more successful in the fight against the COVID-19, 7 of them are led by women. So they demonstrated that they could be very good leaders, make the good decisions, and so on. And also, I mean, everybody was applauding the health workers. 80% of the nurses are women, and so on. So let's please, if we build back better, please give women the chance to be and have the opportunities and right we all deserve.
Somebody who fought very hard for gender equality, especially women's rights, just passed away. I'm talking about Judge Ruth Bader Ginsburg. And now at the very tail end of this term of President Donald Trump, there's a new face that shows up, Amy Coney Barrett, the new Supreme Court nominee, and her nomination could have a strong message, especially for women's rights. What are your thoughts about this process, especially at this time?
Well, first of all, I I have to say that I had the privilege to meet Ruth Bader Ginsburg, and she was a formidable lawyer, but also a judge. And I think, as you say, she worked so hard for gender equality, and it impacted so many lives across generations and beyond the United States. So seeing the numerous tributes to her work and legacy was uplifting. I think that judges should strive for gender equality, and that is really relevant. And I hope that the US could resume the role promoting gender equality, including access to sexual and reproductive health and services.
Legacy, that's a key word. High Commissioner, we have a question now from Mary Bassett. She's the director of the FXB Center for Health and Human Rights at the Harvard Chan School.
High Commissioner Bachelet, ratified conventions and covenants have been critical to the effort to ensure and protect human rights. We at the FXB Center have been concerned that more than these legally binding instruments are being broken in the many tragedies experienced by migrants. It seems that we're losing a sense of social solidarity and generosity towards those who face intractable adversity. Can you talk about these challenges?
Well, indeed, I think Human Rights Convention, we have 9 core treaties, are the cornerstone of the whole human rights system. They have proven to be a strong engine to advance protection of human rights worldwide. And the call for universality is made also by the drafter of the Universal Declaration of Human Rights, including Eleanor Roosevelt, remain ever so relevant today. We need to continue honoring this spirit. And as you said, yes, I think the human rights framework has been in constant evolution. It has adapted to incorporate the right of those facing, as you say, the intractable adversity. For example, the most recent convention being negotiated is on the rights of older people. So it's also about to create greater accountability mechanism as to hold states accountable when the conventions are not upheld. But if I may say, the first step, however, remains that states ratify the treaties, especially in cases where states have not become parties to the core treaty. To give you an example, the US is not part of the Convention on the Right of the Children, of the Right of the Migrant Workers, and the Covenant on Economic, Social, and Cultural Rights. But beside that, I do agree with you that we have lost solidarity. I was mentioning at the beginning, we have lost the sensation that we are in all of this together, and we have lost, and you can see it with migrants, you can see it with IDPs, and internally displaced people, or refugees. And I think we need to speak out, to call people on the solidarity. I mean, your country, my country, has been made of indigenous people, but also migrants. So the contribution to all of our society has been so important. So I think we need to continue speaking out in favor of migrants, but I think we need to rethink what is the relevant, and I think we need to rethink how we are able to to rebuild a sense of collectivity, a sense of solidarity, because I have not seen it too much in the world. Of course, if you go to some very poor countries, at the community level, they do have they are really with a lot of solidarity and generosity. But I think we need to, and I think the media has to help us a lot on that as well.
Now that you are mentioning, High Commissioner, immigration, there's a very disturbing story reported by the New York Times recently of an incident that happened at a NICE facility, ICE, in Georgia, that some members were pressured into invasive gynecological procedures that may have been unnecessary. Again, this is a New York Times report, and in fact, a nurse came forward with the story, and that's how we found out about it. How do we implore and ask more people to come out and speak the truth about these injustices, especially in the context of vulnerable people?
Well, the first thing, it's important that people who speak out against irregularities, against violation of human rights, need to be protected from reprisals. I mean, they many times when people do that, they get fired, they get attacked, harassed. So that's why many people sometimes don't get out. But, and that's why for us, protection of human rights defenders or whistleblowers is essential to ensure that civic space remains healthy and vibrant. My office is aware of the allegations you mentioned of hysterectomies being done to women that were being held in immigration detention in the United States. And I have to tell you, these are very serious allegations and need to be independently investigated. I understand that the Congress has called for this and that such investigations are underway, including by the Department of Homeland Security Inspector General. But I have to tell you, hysterectomies practiced without consent are forced sterilization, which are considered a human rights violation under the international law.
Indeed. The pandemic is also creating a widening wealth gap that we talked about. The rich are getting richer, the poor are getting poorer. Can you speak a little bit about ways in which wealth inequalities in particular can exacerbate the aspect of health, the health inequities in particular?
I mean, yes, of course. I mean, being poor in poor countries where, I mean, this will depend on the country we're talking about, because there are countries who understood that the primary care facilities were essential. So even though they might not have the most sophisticated medicine, they do have access to the main programs in terms of food, milk, a vaccine, and of course, medical and dental care, nursing care, etc., newborn programs, etc. So it's not only about, I mean, it depends how the country have also understood the importance of universal health coverage. But it's clear that somebody's poor, and if somebody lives in a very rural area or a very far away area, as if a country don't have, I mean, people who live in those areas in many places of the world, they don't have even highways. I mean, in many places, if they have, I mean, if a mother has to give birth, she has to leave before to the biggest city closer, so city, because there's no ambulance that could get there in the time that is needed. So there's a lot of factors. On one hand, the food insecurity, the nutrition, the lack of water. So all of those are components that implies that many people have a worse health condition, the kind of food they eat, etc., than people who are richer, that have access to everything and that very easily can solve their health problems. So that's why we have always said that health is not the absence of disease, and that health is a sort of a welfare state, and that there's so much the social and economic conditions of health.
We are now going to present to you a question, High Commissioner, from Professor Daniel Wickler. He's Professor of Ethics and Population Health at Harvard-Chan.
President Bachelet, it's a privilege to be in dialogue with you. I've admired you for many years. Today's public health response to the pandemic is unfortunately highly politicized. And one unexpected feature of the opposition to attempts by the authorities to halt the spread of the disease by non-pharmaceutical interventions has been an insistence on the part of opponents of regulation that these measures violate individual rights. They don't use the phrase human rights so much, but individual rights certainly. Do you have a response to the claim that individuals have a right to associate with whom they please and to act as they please and to do business as they please that's being violated by these public health officials?
No, I don't agree with that. I don't agree that their rights are being violated because, as I told you before, the international human rights law indicates that in case of natural disasters and in case, of course, of health pandemics or other situations, health officials not only have the right, they can do it, they are it's mandatory to do it because it's their right. It's also linked to the right of the other, of the neighbor, of the people who is there. And then we all need to protect ourselves to protect the others as well. So I would say the only important thing, though, is that those measures, so-called emergency measures, there are some kind of them. And it is, for example, the freedom of assembly, you can restrict it because you cannot have people gathering together. The second is the freedom of participation, freedom of mobility, with the lockdowns and so on. But of course, this has to be related to the kind of situation you're dealing with. So it has to be proportionate to the needs. It has to have a time bound, and it has to be explained clearly to the people why that is needed, and the least intrusive option to achieve the desired result. So as the public health situation evolves, restriction on peaceful assembly can be systematically reevaluated to assess whether they remain necessary and proportionate. Because what may have been very needed at the beginning of a pandemic, maybe afterwards it can not be appropriate. But I think that I think the states have the responsibility to ensure people's health, so they can take these decisions. And I think the health officials must be supported, and particularly all the institutions that have been decisive in the management of this and other diseases in the past.
High Commissioner, you mentioned now science and scientists, leaders. From the very beginning of this pandemic, it was very clear that the world needed leadership. And that comes from science these times, because this is a pandemic. So as a physician yourself, how do you see, this may be a combination of communication and sciences, but how do you see these troubling trends that we're seeing globally in a sort of war on science, as a physician yourself?
Well, first of all, I have to say that even as a president, I always took decisions in science, in evidence-based facts, that we could really ensure that there were the best solutions for people. If we're talking about a vaccine, or we're talking about an epidemic or whatever. And of course, as a physician, I do believe that science is fundamental. If we think today in front of COVID-19, there's so much we still don't know. There's so much that we still don't know. Nobody knows if it will be like a flu, that it will mutate every year, we'll need new vaccines, and people have got twice the virus, so it looks like, and it was not the same genome in Hong Kong. So there's so much that we don't know. So we need science. And I think this is more a political issue, because in the scientific community, they all agree on what to do to move forward. I mean, maybe there are some little nuances, but what I mean is scientists understand the importance, for example, of having a vaccine, of ensuring the so-called physical distancing, et cetera, the use of masks. And then you find places where they're still discussing if a mask is needed or not. So yes, we need science, but we also need institutions that people can trust them. So they can, when they speak with the science, with the word, and we need communication, of course, based on science, that can, I would say, make people believe, make people have trust in what they're receiving as instruction. And institutions shouldn't be undermined.
High Commissioner, I have a question from the audience. This is Eric, and he asks, in some countries, the pandemic had been a convenient excuse to suppress freedoms of speech and expression. Some countries have limited the freedom of the press. What can you, as High Commissioner, do?
Well, what we have been doing is, since the beginning of the COVID-19, we have been speaking out. We have been making press declarations, press releases. In every session of the Human Rights Council, we insist on this regard. And in particular, we can speak with the member states. We can send letters to the foreign ministers, or if we have the chance well, not to meet now because everything's being virtual. We are able to raise these issues. Me personally from Geneva, or our colleagues from the field as well.
We go now to a question from Olay Norheim. She's adjunct professor of global health and population. Here it is.
I'm interested in the ethics of vaccine allocation within countries. Health personnel has been, and rightly so in my view, identified as high priority groups for getting vaccines first. So have patients with comorbidities and high age. But what about socioeconomic risk factors? Should not wider non-medical risk factors also be taken into account?
I think so. I think we need to take into account, because we were discussing about the relationship between poverty and social and employment and so on, and the spread of the pandemic and the possibilities of having a better health. One of the situations that we have, for example, and that has been very difficult to manage the crisis, has been that in the world, the percentage of people working is like 60% or more in the informal economy is huge. All those people in the informal economy don't have access to any kind of benefits, social protection schemes, and many of them are women. So they are in a very fragile situation. On the other hand, in many other countries, you have places where the people sells little products, so it's a daily basis income, and if they don't have that income, they just cannot eat, they cannot pay rent, etc. So I think socioeconomic situation needs to be considered, and that is very important. But because you are on the vaccine, I want to insist, because I'm like preaching on this, is that the vaccine should be a global public good. Because the only way that we're going to be safe if everybody else is safe, and that it will take time. Maybe there will be a discussion who receives first the vaccine, and I think everybody agrees on the health workers, of course, but and the essential workers. But we need to do better, and we need to ensure that everyone. I know it's difficult, 7.2 billion people on the planet, but that will be the only possibility. Otherwise, we'll be limiting mobility and trying to make other kind of things to avoid the spread of the pandemics.
Thank you to Mr. Olay Norheim for the question. High Commissioner, when we think about vaccines, we know it's a very complicated system that starts with the design, then it goes into the trials, then production, and later on distribution. We are doing this at extraordinary times right now, and the advance is unbelievable on the part of the companies, just a few that are working already in the human trials, and then the hundreds that are working on the initial phases. But in terms of distribution, are you concerned at all about the black market? So those who have money would get it first and everybody else will come second.
Indeed, that is experienced in many other situations. The richer get better, we get first, but that would be a tragedy. That would be a tragedy. So because we need to, I mean, you can, as I say, you can prioritize sometimes because it's the production is not yet where they are, but it shouldn't be that there are people who can pay it, have it, and the rest not. I think including access to all medicines and of course vaccine, we have to have 4 dimensions. They must be accessible in all parts of the country, but of course of the world. They must be affordable to all, including those living in poverty. They must be accessible without discrimination on any of the prohibited grounds, and reliable information about them must be accessible in order to facilitate informed decision-making. Yesterday, I was talking to a media, and they were about these people living with disabilities and COVID-19. And they were telling me that people living with disabilities are really concerned, first of all, about the triage that was done at the beginning in many medical facilities, and second, that if they're going to receive a vaccine when there is one that is safe and adequate. So we need to stick to these 4 principles, if I would say.
Fantastic. Now, I would like to talk about reparations, because particularly in June at the Human Rights Council meeting held in Geneva, you urged countries to address systemic racism and centuries of violence and discrimination through reparations and other processes. Can you elaborate a little bit?
Well, yes, I call on countries to do so. As you said, it was during the session. I mean, there was an urgent debate on racism after the killing of George Floyd, and we have a very powerful testimony of Philonis, George Floyd's brother. Because, I mean, behind today's racial violence and discriminatory policing lies, I think, the failure to acknowledge and confront the legacy of the slave trade and colonialism. So that means that we make amends for centuries of violence and discrimination, including through formal apologies, why not? Truth-telling processes and reparation in various forms. And I will want to share something that I read recently, that California state has recently been adopted legislation to look into possible forms of reparation for people of African descent and descendants of slaves. And I salute California as the first state to have adopted such groundbreaking legislation and hope that other states do the same. But I have to say, in next March, I have to present a report in the session of February-March in the Human Rights Council looking into systemic racism, including in law enforcement, through the report mandated by the Human Rights Resolution 43/1. And this report is part of the efforts that the UN is doing to combat racism, because we are in the middle of the International Decade for People of African Descent. And we need to do much more, so I've been calling member states to do much more. Next year, that it will be 20 years after the Durban Declaration against racial discrimination and racism.
Hi, Commissioner. You talked about California, and this weekend there was an issue in Chile, your own country, that has to do with minorities. And Argentina has the same problem right now. So it seems that in some countries the effort is very strong in order to help incorporate these groups, and in others there are issues that seem to be barbaric, even in societies that are pretty advanced, like the Southern Cone in Latin America.
Well, yes, I mean, we have reported human rights violations in every part of the world. Last year, when there was this mass demonstration, I sent a team there. They wrote a report explaining all the violations, and at that time we could see police brutality as well. So what that led to a reform of the police, and I also asked them to revise the protocols of the use of force during a manifestation when they were under violence, and that is something that we have been trying to work not only in Latin America but in other countries as well, because we have problems many times with security forces and armed forces that, trying to ensure security, they violate the human rights. So we are trying to train many of them on how to do their job in compliance with the international standards of human rights.
And probably back to the basics, no? Conversation at home, at school about this, and we start from the basics and then we let the institutions continue. I have a question from the audience. It is Elizabeth. She asks, can you reflect on the human rights implications of reducing school access despite the robust, she says, robust evidence that children rarely transmit COVID-19, as data from India has recently underscored? How will this generation, particularly the vulnerable, suffer from deprivation of schooling?
The first thing, I'm not so sure if that robust evidence is so robust, because I just read a report yesterday saying that children did transmit a lot the virus. But it doesn't matter. We're not going to focus on that. I'm going to focus on the question on the lack of access. Well, yes, it's very complicated for many children. They do receive lunch at school or breakfast at school. So when the schools are closed, they are not receiving anything. The second thing that is bad for people, more vulnerable people, is that, of course, 50% of the population don't have access to online. So education could not be continued in many places. And of course, that changes the future of a child. And in the Ebola crisis, we saw that many children who that never went back to school. So it's very complicated, and I think it will mean a lot of efforts from governments and the educational system to try to provide access, to make them come back to school, to try, well, there is one SDG, a Sustainable Development Goal for the Agenda 2030, that is to ensure access online and energy and electricity for everyone. So we will have an impact, and of course the ones who are less resourced will have the bigger impact. And that's why many countries have tried to solve it through virtual classes. But I think there's another impact we still don't know. And everybody knows that older people, for example, do have a fewer mental health impact because there's isolation and so on. And they need social life to feel healthy. But in children, it looks like there's also a very important mental health impact that I guess universities will start studying and analyzing and seeing. So in that sense is why in some countries they're trying to bring back schools so children can continue socializing and learning. But
Yeah,
the decision that has to be very balanced, because, for example, here in Geneva, children are at school, but parents cannot go inside. They have to go with masks. They take other kinds of precautionary measures.
This combination of virtual schooling and physical schooling may be the answer, but we need good connectivity in all countries, because if we have bad connectivity, it would be a problem. Now, we have a question from a graduate student, Swati Srinivasan, and here it is.
How do you hold politicians accountable? For example, what advice would you have as today's UN High Commissioner on Human Rights to address the human rights abuses of people like Duterte and Bolsonaro and hold them accountable?
Well, I would say in general that the pandemic has shown us what type of leadership has been able to successfully steer countries through these complex times. Leaders who have been decisive, but at the same time transparent, communicative and innovative have fared better. And as I already said, many of them led by women. So we need to focus on such style of leadership to get us through current challenges. How to hold them accountable and not, as we remember, many of these leaders have used the pandemic as justification for human rights violations and arbitrary detention and so on. In some cases, such decisions are being questioned in courts and by other mechanisms. But on the other hand, countries who have signed all these treaty bodies we talked before, they have, and they have ratified them, they have the obligation to ensure the human rights, being it human rights in general, social, economic, etc. The right of the women and the children, etc. So it is, even though head of state is representing the state, so it has a legal obligation to ensure that the human rights are being respected. So in which regard this is happening, the treaty body system, they every 4 years, they analyze a country, or they receive petitions from people who insist that their rights are being violated, and there will be decisions made by the Human Rights Committee, not council, committee. Those are experts, legal expert judges, and many of those decisions of these committees have been used in trials in the countries. So it's not easy. And the other last part, I think that is more important, is that people have to hold them accountable. So if people elected them, when they have to make a new decision, they have to make the right decision.
Making decisions is key, especially those who are at leadership positions have to make decisions constantly at 24/7. Let's talk a little bit about your 2 terms as the President of Chile that I distinctly remember. We followed you very closely in the media. In Chile, there are not consecutive terms. You had the chance to come back after a period, a gap. Now, was being president of your country the hardest job you've ever had?
I think so. I mean, even though this one is not pretty easy, yeah. But it's different, because when you are president of a republic, when in my country you are head of state and head of governments, both, and we don't have prime ministers. So it's pretty. I mean, it's the sense of the responsibility. You know, you have to be able to take good decisions, thinking on the whole country, on the people, of course, in the more vulnerable and more needed ones, but also at the whole country. You need to have, I mean, it is a hard job, but one key issue is to select well the people you work with. I'm talking about ministers, vice ministers, people who know what needs to be done. You need to have been, before being a president, to have a good program with all the contents and all the things that you want to do if you are elected. And of course, you should tell the truth and not lie about it, not promise anything that you cannot do.
Now, I distinctly remember the issue with the students, the marches, the protests in several cities in Chile at the time, something that has not been resolved, and it appears to be a very big problem. Did that keep you up at night?
Well, the thing is, we did do a very important educational reform. In terms that 70% of the students, the poorest students of Chile, go free of charge to universities, and many of them were first in their families. So there's a lot of things that we could achieve. Of course, not everything, because it was only 4 years, but there's a lot of things we could achieve. And I found many times people who write me letters saying, oh, thanks to you, my son is in the university, and so on. We did a lot also as well on education, on primary education, and not primary, sorry, kindergartens and nursery schools. But the thing is that we still have, I would say, in my country, lack of, there's not the same quality of education everywhere, even though that's, I think, the next challenge, to improve quality education. To improve it, it's not that bad, but we need to improve it for everyone. And the other challenge, I would say, are socioeconomic challenges. Mm-hmm. People disappointed with the opportunities of employment, people who studied something, but then they have to work in another thing, different thing. So, and there's a lack of, and also the feeling that we need a political system where people can participate much more. And I think that's what is going to happen soon in the plebiscite, to decide if a new constitution is approved. I mean, if it's done. I did that. I did the new constitution, but the current government stopped it, froze it in parliament. So now there's the whole discussion in the whole country that the need of a constitution that defines better the role between state and market, defines which are the values, the principles and values we want to live in. I'm not going to be able to go to vote, but of course I would vote I approve.
Now, I was thinking that 2021 is still a question mark for many. So all these things are going to be perceived come January 1st differently. But let's see a question now that we have from a graduate student. Malia Shefti is here for you.
As we have seen from the last few months, the coronavirus pandemic has highlighted long-standing systemic health and social inequities, with an increased burden on minority groups, women, and impoverished people. What advice do you have for students who are looking for ways to get involved, make a difference, and help alleviate this burden?
Well, I think it's very interesting, the question, because if you see, youth have been getting a lot of negative press recently as careless or transmitters of the virus, particularly as we move to second waves in the number of countries. But I have to tell you, we did with ILO and a number of partners a global survey with youth in 112 countries. And the survey covering youth demonstrated that young people were determined to step up and partner safely and effectively to build back better, with more than 25% of young people having reported that they actively engaged in volunteerism, for example, and making donations towards the COVID-19 response. In some other people organize themselves to bring food to people who are living with disabilities and cannot have mobility, or people who are in older people. So I think the findings confirm that youth are part of the solution, actively contributing to the efforts to reduce the spread of the virus and mitigate the pandemic's impact by being highly compliant with stay-at-home measures, and were in favor of stronger containment measures. And their actions include, among others, providing support, as I said, in people in vulnerable situations, both online and offline, fighting against the spread of misinformation, as well as saving life on the front lines of the pandemic.
High Commissioner, we followed you from Chile to New York, now to Geneva. 2021, I was mentioning, is about to start. What is your wish for the next year?
Well, I would wish that we could have a solution to the coronavirus, because it's affecting, as I said, disproportionately the most vulnerable ones. I would like a world where could really see that it's a global challenge and it needs all of us, that there won't be unilateral responses. I mean, of course, you can have concrete health response and so on, but we need to think on this. We need to rethink the world we want to live in. We need to rethink the economy. We need to rethink if the political systems are working or not, because people cannot accept continuing in this so unequal world. What we don't need is to go back to this day zero before the pandemic. We need to identify that all those inequalities, all those situations cannot continue happening. And I will hope that this movement can really have an important outcomes that could make everyone live a little bit better on 2021. In 1 year, we're not going to change everything, but maybe we can provide better conditions to a group, an important group.
And it's a commitment for everybody. So let's reshuffle, look at the horizon, and go there and capture the world and fix everything in order to achieve equality for all. I want to thank High Commissioner Michelle Bachelet. This has been an extraordinary discussion. Thank you, Mrs. Bachelet, for your time, for your concepts. Also, Dean Williams, Professor Castro, and the Harvard Chan faculty and other guests who shared their questions, their comments, and participating virtually or from messages directly to us. Thanks to our audience. Thank you at the Harvard T.H. Chan School of Public Health and the David Rockefeller Center for Latin American Studies. Thank you and goodbye.